tonight, welcome to the Truth Experience Show. According to World Health Organization, 29.4% of Kenyans are said to have hypertension. Unfortunately, 70% of those don't recognize that they have hypertension. Hence, the silent killer disease. Kwa lugha ya Kiswahili, shinikizo la damu. Today, I will be your host, Lawrence Joroge, as we dive deep into hypertension, together with our guest, Daktari. Kindly introduce yourself.
Okay, thank you so much. My name is Dr. Everlyn Kawira. I'm a family physician by profession. Yeah. Thank
you so much, Daktari. We shall go into our first question. Just to ask you, Daktari, would you kindly describe hypertension?
Okay, hypertension is elevated blood pressure, which is a systolic blood pressure of above 140 and diastolic blood pressure of about 90 and above, and this is 24 hours apart.
Okay, thank you so much, Daktari. Now into that, I have just a simple question in a layman language. Would you describe blood pressure kama tu vile tuna describe flow ya maji kwa pipe, the flow of the water in the pipe?
Okay, elevated blood pressure ni wakati damu kwa the arteries inapita mara mingi kwa the heart in a minute if it is above 140 kwa ya systolic blood pressure, alafu more than 90 kwa diastolic blood pressure.
Okay.
Yeah.
Now, Daktari, now we have highlighted hypertension. So meaning, is there low blood pressure?
The blood pressure, the normal blood pressure usually is around 120 over 80. That is the normal blood pressure for adults. That is age above 18 years.
Okay.
However, you can have blood pressure which is pre-hypertensive, which is between 120 to 139, that is for systolic, and 80 to 89, that is for diastolic. Yeah, then above that, that is now the elevated blood pressure, which is called hypertension.
So, meaning blood pressure, we are operating within a given range.
Yes.
Okay, thank you so much, Daktari. Now I'm into that. Assuming I have a kid who is, let's say 5 years, another person 15 years, and now 40, and probably I'll go to age 60. What is the expected variation of blood pressure?
For the children, usually they have, there's a range for the blood pressure, especially for children, and also for age between 10 to 18, there is the expected blood pressure.
Okay.
Yeah, then above 18 years, usually it is supposed to be 120 over 80.
Okay.
Yeah.
Thank you so much, our Daktari. Now, the other question I have, now we have said that blood pressure, we are talking now about systolic and diastolic. Is there a relationship between blood pressure and now the heartbeat?
The heartbeat is now called the pulse rate.
Okay.
Okay, is the heart rate.
Okay.
Now, when the heart rate, when it is beating at 120 times in a minute, that is the okay.
I'll just give you a recap of the same question. Daktari, I'll just rephrase the question in this manner. Okay. Normally, if we have, there comes a time, for example, if I do an exercise, my heartbeat will increase. That's obvious. Now, the question is, if my heartbeat is very high, will it also have an impact to blood pressure such that I can say my blood is flowing at a high rate as you described hypertension?
Okay, well, when someone is doing an exercise,
Okay.
there is an expected blood pressure rise that occurs, and that could be similar to the pulse rate. So when we are taking the blood pressure, we usually advise people to rest for about 5 minutes, so that now the blood pressure, assuming they were doing some exercises, then the blood pressure will come to the normal blood pressure for the person.
Thank you so much. Question well answered, Daktari. Now, Daktari, I heard you mentioning about systolic and diastolic. Now, I want to go to the test. Now, how, in just a simple language, how do you come to that level of determining that I have hypertension? Now, you can take us through the journey of testing.
Okay, so for the hypertension, for us to test, we also need to find out the history of the patient, of the past patient. So sometimes you can classify the hypertension into two, depending on the causes. You have the primary causes, primary hypertension, and the secondary causes. The primary causes accounts for less than 10% of the population. Then the secondary causes are more than 90% of the causes. So for the primary cause, usually it's genetic, maybe family history of the hypertension. And then for the secondary causes, that is where you can actually find a cause. Yeah, because the causes can be maybe issues with the kidney, issues with the heart, and other issues. And actually now when you start testing, you are likely to find what is causing the hypertension.
Now, Daktari, assuming I have just come to the hospital, and now you say I want to test blood pressure. As a patient, or just like a normal, I'm just coming for normal checkup, how do I expect the process to look like? Now, in terms, just to be clear to the question, the instrument you measure, how you do it, just in a simple description of the procedure.
Okay, I would say most of the time, sometimes someone who has hypertension, they may not be aware that they actually have the hypertension. So when you listen to the patient, they will tell you they have a few symptoms. And now you will recommend to actually find out the blood pressure of this patient. And that's where now you have, you ask the patient to relax for about 5-10 minutes. And then now you have the blood pressure machine. I'm sure you know, you know the blood pressure machine. Then you sit down, and then the blood pressure is taken on the arm. Yeah, and the level of the arm has to be at the same level with the heart. Yeah.
Now, Daktari, if we may ask, why the arm? Why not the head? Why not the leg? Why specifically the arm?
Yeah, actually the arm is used because we are looking at the blood pressure at the artery in the arm in relation to the way the blood is pumping in the heart.
At the heart.
Yeah.
Thank you so much, Daktari. Now, as you were describing the procedure, assuming now I'm there back at home, would you highlight some of the signs or the symptoms that I'm highly expected to experience?
Yeah, well, for high blood pressure, most of the time, the patient may not know that they are having the hypertension, mostly until some of the complications have now set in. But a patient can have headache. A patient can also have blurring of vision, or the vision may not be clear. And then also the heart could be inapiga kwa nguvu. Anasema the heart inapiga kwa nguvu.
No.
Yeah.
Now, Daktari, there in now hapo kwa causes, do I expect a constant reaction? Like for example, assuming niko na like, do those signs appear in simultaneously, or if I'm just experiencing headache, or they can come in a combined form?
Depending on the complications, because once the elevated blood pressure has been there for some time,
Okay.
it would cause other symptoms. For example, in most of the organs of the body, you might have the pressure affecting the eyes, also the pressure affecting the heart. So when it affects the eyes, the person will complain that they're not able to see very well.
Okay.
When it affects the heart, that's when now the patient will now start saying that they're having it's called palpitations.
Okay, Dr.
Yeah, and then now for the limbs, they will have issues of having pins. Someone will say that pins are pricking on especially the hands and the legs.
Okay, Dr.
Yeah.
Now, into those, now we have described now the symptoms. Now, what are the causes? What will make me to have hypertension?
Yeah, well, the causes of hypertension, we can classify them into two causes.
Okay.
Yeah, and these two causes, you have the primary causes, which are usually the idiopathic causes, and they account for less than 10% of the cases of hypertension.
Yes.
Then you have, for the primary causes, these are the causes that you cannot see. You cannot attribute to any identifiable cause.
Okay.
Then for the secondary causes, that is secondary to an effect. For example, maybe the heart has now led to the hypertension.
Okay.
Maybe a kidney disease has led to the hypertension. Or maybe a vascular cause, which is now the blood vessels.
Yeah.
When they have an issue, then they can also cause the hypertension.
Okay, Dr. I'll dive deep into secondary before coming back into primary. Does it mean for me to have hypertension, there must be something that is triggering that for hypertension to happen?
You said what?
Okay, what I mean is this. For I to have hypertension, now I'm deep into secondary. Does it mean there must be a trigger? Like, what do I want to mean? Like, for me to experience a certain disease, you might tell me you did not eat well, that's why you're experiencing this. Isn't there a specific thing that you might attribute to the cause of hypertension?
For the secondary causes, these are the least common.
Okay.
I say it's less than 10% for the secondary causes.
Yes.
For the primary causes, these are the ones that account to the 90%.
Yeah.
So mostly for the primary causes, you cannot find any identifiable cause.
Yes.
But for the secondary causes, you can actually pinpoint the cause of the hypertension to some of the causes.
Now, would you describe just examples out of now that secondary bit?
Okay, for the secondary causes, you can also classify them again into vascular causes, maybe an issue with the blood vessels, like the coarctation of the aorta. So those are issues with the blood vessels.
Yes.
Then you can have an issue with the kidney, maybe a condition called pheochromocytoma. That can also lead to elevation of the blood pressure. And also the renal artery, the artery in the kidney, in the adrenal gland can also cause renal artery stenosis, which can now cause the elevated blood pressure.
Okay, thank you so much, Dr. Now, in our African language, mostly unapata mtu anakuambia na uchuge stress inaweza fanya upatwe na shinikizo la damu. Maoni yako ni yapi kama daktari?
Well, it is true the commonest causes are now the issues around stress, issues around genetic predisposition.
Yes.
Yeah, and now especially the stress, the stress aspect is the most common cause. what we do is we advise people to manage the stress. I think the stress can be managed,
Yes.
and that would be the best aspect so that the blood pressure can be lowered.
Now, Doctor is still on that issue of stress. What is the relationship between stress? That it is coming to a point that what I'm thinking is affecting my blood pressure. Would you credit ujaribu kwa ufupi uelezee?
Well, so when I think when someone has stress, how I would explain what I think is that when someone has stress, there could be maybe issues around emotion and that are now causing the person to think so hard, and this can now lead to an elevation in the blood pressure. Yeah.
Okay, thank you so much. Our viewers, keep your question coming as we keep to more engaging Daktari about our questions. Now, Daktari, still I'll go back now to the primary cause. Now we are talking about genetics. Now, when we talk about genetics, is that we are passing from one person to the other. Is it the reality, or how would you describe the genetic aspect of hypertension?
Well, for the some of the primary causes whereby we talk about genetics, the genetics is issues of maybe you ask a patient if there is somebody within the family that has ever had elevated blood pressure, and then they tell you that maybe one of their relatives had elevated blood pressure, or maybe had maybe a cardiovascular disease, and now you attribute the elevated blood pressure to that history.
Okay, thank you so much, Daktari. Now, still into that aspect, is it possible that my grandfather had blood pressure, my dad no blood pressure, but I have blood pressure? Or is it something that will now come from grandfather, dad, then to me?
Well, we wouldn't say that it is like, okay, when we say the genetics aspect, we don't say that it is passed from, okay, it can be passed from one person to another, but I think even other aspects of maybe the lifestyle, the way someone lives their life, maybe the diet aspects can also contribute to the elevation of the blood.
Now, Daktari, now I'll dive now into lifestyle. You highlighted something about lifestyle. I'll just give you some time to just explain it in your own language about the relationship of hypertension and the lifestyle, especially in our modern day society.
The lifestyle, for instance, living a sedentary lifestyle, that is whereby someone doesn't do many exercises. So that can lead to elevation of blood pressure. Also, the diet that someone consumes. There's a recommended amount of maybe the carbohydrates, maybe the vegetables that one has to feed in a day, so that it doesn't also lead to elevated blood pressure.
Daktari, now I'll go into diet. Just give me one thing that mostly in terms of diet that will cause blood pressure.
Like for example, excessive alcohol.
Okay.
Excessive caffeine.
Yeah.
Also, excessive fats.
Okay.
Yeah.
Now, Daktari, in terms of diet, I want to highlight something about salt. Most of us, to our viewers, we love salt. It's our common norm when taking our meals. Now, Daktari, the relationship between salt and hypertension, if any, exists.
Yeah, sure. High salt diets can also lead to an elevation in the blood pressure, and usually we recommend a a teaspoon of salt in a day, which is equivalent to about 2,300 milligrams.
Okay.
Yeah, for the adults.
Daktari, to our viewers, mostly mathematic terminology is so difficult. Would you describe what you have said in terms of a tablespoon?
Okay, well, yeah, the 2,300 milligrams could be not something that probably we are able to measure. Mm-hmm. So a teaspoon is usually the recommended for adults, and that is per day, cumulatively.
Daktari, I have just, in relation to salt, does it mean, for example, I realized during the day, my food did not have salt, and during the evening, also my food did not have salt. And now I decided to take that spoon, then water, I stir, and drink. How would you describe that situation? Because the reason I had to describe that, most of us, when we have stomachache, that's usually what we do. Is it something that is healthy, especially in now the aspect of hypertension?
Okay, we recommend that the salt has to be cooked. So actually, we discourage the issue of adding the salt at the table. So it has to be cooked, well cooked.
Okay, now Daktari, we have realized now the causes and whatever. There is something I just go to regular checkup. Assuming even I don't know, because most of us hatujui ya kwamba hata pia kuna ugonjwa unajiita shinikizo la damu. How important is testing? Even just regular to checkup. Yeah,
testing we recommend that people have to have the regular checkups.
Yes.
Not necessarily when they have symptoms. People can have the checkups maybe once per year, just to find out if the blood pressure is elevated.
Okay. Once per year?
Yeah, it could be a regular checkup.
Okay, thank you so much, Daktari. Now I want to go to the other aspect of treatment. Now, most of us, if I may just go into forehead, is it a disease? Is it something that I will live with and manage? To you, Daktari.
What?
My question was this. First, is hypertension curable? Or will I just have to maintain it and maintain it?
Actually, when we find out that the person has elevated blood pressure, and this can be, it could be elevated between 130 and 89 for the systolic.
Okay.
130 and 139 for the systolic, and 80 to 89 for the diastolic. Usually we advise the patient to do dietary adjustments.
Okay.
And also, even if it is elevated, we encourage people to have the dietary modifications in order to lower the blood pressure. So once the patient has started treatment for hypertension, we also encourage the lifestyle management, because we know that the lifestyle management can actually lower the blood pressure even as the drugs are doing the same. So,
Daktari, does it mean, assuming today, okay, not assuming, we are in 2024. So 2023, I had blood pressure. 2024, my blood pressure is normal. Then again, 2025, my blood pressure is high. Or is it, if I get the disease, nipone story yangu imeisha hivyo, ama nikituna nagojeka napona, nagojeka napona?
Well, we encourage people, once they have like blood pressure above 140/90, we encourage people to have a regular follow-up with the doctor, so that their blood pressure is correctly managed, Once the drugs have been started, you monitor. So sometimes the blood pressure can go so low, but before you stop the drugs, you have to be followed in the hospital.
Okay, Daktari, another question. Is it possible I have high blood pressure, at the same time I'm experiencing low blood pressure?
Sorry?
My question is this. For example, last week I go for checkup, my blood pressure is high. Is there a possibility I go to the test next week and my blood pressure is now low than the normal?
Yeah, it is true. The blood pressure varies. Actually, the blood pressure can vary even within the same day.
Yes.
You can have the blood pressure having variations.
Mm-hmm.
For example, in the morning, in the evening, it could be not the same, but it should be within the normal ranges. However, sometimes maybe when you have done an exercise, you might find that the pressure has gone slightly high, but not in the ranges of hypertension. Then now, once you have relaxed, you find that the blood pressure has now is within the normal ranges.
Doctor is still on that question. Now, the question is this. Now, we know now, I'm already diagnosed, I have hypertension, the high blood pressure. Okay. Then, it comes to a point that it goes to an extent that now my blood pressure goes to the lower extreme. No, not within the normal range. That's the question that I have.
Yeah, okay. Once the blood pressure is managed and now the blood pressure is coming down to the lower than the normal ranges,
Yes.
the clinician will now have to maybe taper down on some of the medications that the patient is taking.
Okay.
And this can be managed over time, even as the pressure is monitored.
Okay, Daktari, we were highlighting, I'll just go a bit into testing. We were talking about systolic and diastolic. Now, in terms of that, what we were calling 120/80, if we may say. Now, is it possible that the systolic can be high? Let's use an example of like even 145, but the diastolic remains at a normal age.
Yeah, you can have isolated systolic hypertension.
Okay.
Yeah, or you can have isolated diastolic hypertension. Yeah, but they still have to be managed.
Same impact?
We say that the diastolic is the one that has quite a big impact in terms of the complications.
Okay. Thank you so much, Daktari. Now, what is the worst case scenario of a hypertension patient? This is what I mean. Assuming I have hypertension, can it lead to quick death? Like instant death? Kidogo kidogo tu pap, I'm dead.
Especially when the hypertension is not managed, a patient can come with complications.
Yes.
By the complications, we mean that it can affect the brain, and now the patient can present with a stroke.
Yes.
And usually by the time the stroke happens is when the blood pressure is quite high, and because of that, if it is like hemorrhagic kind of stroke, the mortality for that is quite high. So it can lead to mortality easily.
Thank you so much. Still to our viewers, it's highly recommended you go for regular checkups into a normal hospital. And today I'll just even ask our guests, how expensive is it for the test of hypertension?
Testing hypertension, I think, is not charged in our facilities. It is free to check for blood pressure. However, the other tests, if you are to test, maybe once someone has hypertension, once you have to check maybe if the heart has been involved, by checking their tests, ECG, there is an echocardiography, there is a test for the kidney. Some of the tests, the basic tests like urinalysis, there is a kidney function test, but other tests could be expensive.
Naam. Mtazamaji, umesikia ya kwamba kupimwa kwa shinikizo la damu ni bure katika hospitali zetu, hasa zile za umma or public hospital. Go for regular check-up to keep your health status fit. Now, daktari, how expensive is it treating hypertension?
Well, the treatment of hypertension, I know we have medical schemes. There is the national scheme, the NHIF, and other medical schemes. For those, it is free of charge. However, if one does not have the cover, the insurance covers, then sometimes it could be expensive, but not very expensive.
Okay.
Yeah.
Daktari, still on that, the duration. For example, today I'm diagnosed with hypertension. And I start the regular checkup and I'm cooperating well with my daktari. Which is the expected period for me to recover and now have normal blood pressure again?
Well, I think it depends with the complications that could have set in. Mm-hmm. We normally advise patients to have regular eye checkups, okay, like maybe once in a year. We also recommend regular checkups of the heart, those tests, the ECG and the echo. Then for the kidney functions, we also recommend regular checkups for the urinalysis and the UECs. Then again, depending on the complication that is there, then now we can escalate the test, including maybe the CT scan, in case maybe the patient has a stroke.
Thank you so much, Daktari, for highlighting aspect of complications to our body parts, especially the kidney and also the heart. Now, Daktari, on that same note, now if today, now mostly we are finding that hypertension is the one that is causing some complication. Isn't there a possibility of the reversal? Like now I have a certain complication that now will lead to hypertension.
Yeah, when high blood pressure is controlled very well, it means that some of the complications can be reversed. For example, you may have complications maybe on the ones that are called neuropathies. This is where someone feels maybe pricks on the arms and also on the legs. When the pressure is well managed, these complications can be reversed. Then maybe for the eye checkup again, once the blood pressure is well controlled, most of the complications can be reversed. However, for a case whereby the hypertension has affected the heart to the point of maybe heart failure or maybe kidney failure, maybe well managing the blood pressure can help in the management of some of those conditions.
Thank you so much, Daktari. Is hypertension gender-based?
Okay. The prevalence of hypertension is rising, as you stated earlier.
Yes.
Yeah, it is estimated like around 2025, we might have like 30% of the adult population having the hypertension globally. However, for the men, they tend to have a higher prevalence of hypertension compared to the ladies.
Hi, men. Hey, wanaume we. It's getting hot here, getting lit. Keep your comments coming as Daktari answers the question. Thank you.
That I'm not sure. Maybe we need to find out why the men have a high prevalence of hypertension.
Thank you, Daktari. Now, most of the time, mimi watu nasikia daktari alikataa kufanya hiyo operation kwa sababu blood pressure yake iko juu. Daktari, unaweza elezea hilo?
Yeah, it is true. Once the blood pressure is quite elevated, then it has to be managed before someone can have an operation. You may have to have a doctor reviewing the management for the blood pressure until the blood pressure is well controlled before an operation is done.
Daktari, what would be the impact now into my normal body functions?
Well, I think if the blood pressure is quite elevated, during the operation, it can also lead to maybe issues of controlling even the bleeding. That's what I think.
Wow, thank you, Daktari. And to that still, Daktari, assuming I'm going to the operation theater in 20 minutes to come, and now my blood pressure is normal, and I've already gone into, now the operation is ongoing. Can there be a variation in the blood pressure? Like it okay normal, during that period of operation?
In case of that, I think the doctor doing the operation would be able to manage the pressure.
So it can vary within that period of operation?
Well, the blood pressure is not static. Like, for instance, if it is maybe 120/80, it doesn't mean that it will remain 120/80 throughout.
Yeah.
It varies, but within the normal range.
Okay.
Yeah.
Daktari, still on that, pregnancy, hypertension, and most of the time, just in the case, going back to the case of operation, unasikia tu inasemekana na daktari alisema huyu hawezi jifungua kwa sababu blood pressure yake iko juu. What is it? How would you describe it?
Well, we advise maybe planning for pregnancy for those who probably have a history of hypertension. And mainly, maybe most pregnancies are not planned. So you can have different types of hypertension during pregnancy. You can have hypertension, which is chronic hypertension. This is hypertension that was there even before someone got pregnant. Then you can have hypertension occurring after 20 weeks of pregnancy. That is called gestational hypertension. Then you can also have another form of hypertension during pregnancy, which is called preeclampsia. Yeah, so we recommend testing even during pregnancy for the pressure so that one can know if the blood pressure is within the normal range.
Now, what is the relationship between hypertension and now the fetus, the impact that it can have?
Hypertension in pregnancy can cause preterm delivery, whereby the baby might not reach term. So it has to, once the high blood pressure has been recognized during pregnancy, it has to be managed very well by the doctor and to reduce some of the complications, like now the preterm delivery, and also maybe even if the blood pressure is quite elevated, it can also lead to demise of the baby.
Okay, thank you so much. Now, still on that, the effect of fetus, will it happen even during the first delivery months, 6 months, 7 months, or it will affect the last stages, or it is just something that can occur within that 9 months?
Sorry?
The question is, we have already seen that hypertension will affect the fetus, but will the effects come during the early stages, middle stages, or late stages, or the effect can occur in any of the stages?
The effects for now, the baby, most of these effects, they are to do with preterm delivery, whereby the elevated blood pressure can cause the baby to be born prematurely. And once they are born prematurely, they could have some of the issues. For example, they have The mother has to be given maybe steroids to help the baby with the breathing. And now when they're born prematurely, they need a setup where they can be taken care of until they are well able to breastfeed and also to be with the mother.
Okay, Daktari, we mentioned something about diet. Would you recommend a given diet such that I'll either avoid hypertension or maintain help in maintenance of normal blood pressure? Just a recommendation of a diet.
Yes, for the diet, we normally recommend it's called the DASH diet. There are dietary approaches to managing or stopping hypertension. And usually for the diet, the way the plate is managed, mostly is vegetables. Then the other aspect of the proteins and the carbohydrates, they take the other half. Usually for hypertension, we normally recommend the dietary management and lifestyle management as the first step, even as the drugs also are being given. So you don't with a doctor, you can be able to choose the approach, but even when you are on drugs, you also have to do the lifestyle management.
Okay, thank you so much, Daktari. Now, obesity and hypertension, how do they go hand in hand, or is there any relationship?
Yeah, it is true. Now we talk about how it occurs.
Okay.
The blood pressure. There can be issues with the blood vessels, whereby we have now the obesity. Usually the fats are now deposited in the blood vessels as plaques. They're called atheromatous plaques. And now this leads to the narrowing of the blood vessels. And now what we recommend is, the reason why we are saying you need exercises is to reduce the obesity.
Thank you so much, Daktari. Now into our last question. Is there herbal treatment of hypertension?
Yes.
Herbal treatment. Herbal.
Oh, treatment of hypertension.
Using herbs.
Using herbs?
Yeah.
Well, maybe that is a question I'll have to research. But I know usually most of the drugs are developed from the herbs.
Thank you so much. Tumesikia. Let's always visit our doctors ili tujue ama tuko na hypertension, so that we can be aware of our health condition. Now, Daktari, I'll just give you a minute to give your final remarks.
Okay, thank you so much for the opportunity to have a discussion on hypertension. What we would like to advise people is to have regular checkups of their blood pressure, because usually there are no symptoms. By the time symptoms have set in, the blood pressure has been elevated for some time. So usually by doing regular checkups of the blood pressure, you are able to know if there is elevated blood pressure, and it can be managed, it can be controlled, and this can go a long way in helping even the managing. For example, if one is found to have elevated blood pressure, it can be managed early enough.
Okay, thank you so much, Daktari. One of our viewers, Paul Kimani, is saying thank you so much, Daktari, for educating us and keeping us more informed. Thank you so much, our guests. Now, that was the Truth Experience Show, where we always give you real talk, real stories, and real experiences. Kindly like, subscribe, and comment. Till next time, same time, and more information. Thank you so much. Asanteni sana.